So can cataracts come back after they've been removed? The simple answer is no, but there is something called a secondary cataract which can impact your vision long after you've had your cataract surgery. Let me explain. A cataract is when the natural lens inside of your eye becomes cloudy and it makes your vision blurry. During cataract surgery, what we do is remove that cloudy natural lens that's inside of your eye and we replace it with an artificial lens. And that artificial lens, which is permanently placed inside of your eye, is called an intraocular lens. Since your natural lens has already been removed, your cataract can never return. That cataract is gone, gone, gone. However, in about 10% of people who have cataract surgery, what can happen is a type of scar tissue can form on the back surface of the artificial lens, and this is called a posterior capsular opacification, or PCO. So here's how that happens. The natural lens is actually surrounded by this envelope of clear tissue called the capsule. And when we remove the cataract, we leave behind a part of that clear capsule. And on that back surface of the capsule, within a year, 2 years, 3 years, what can happen is the capsule can act as a scaffold where your body's own cells start to grow on the back surface of that capsule. And it's almost like frost on a windshield, and it can make your vision cloudy and blurry again. Those patients who develop a PCO oftentimes complain about blurry vision, glare, and halos. And oftentimes, since this vision is similar to what you had at the time when you had a cataract before, some people call this new type of scar tissue, this PCO, a secondary cataract. But technically, it is not a return of your original cataract. It is just a type of scar tissue. But the good news is that there is a pretty simple, easy, in-office treatment for this PCO. The PCO can be removed with the help of a laser treatment called a YAG laser. That's YAG. And this laser takes about 5 minutes to perform in the office. There is no cutting, no bleeding, no pain, no restrictions to your activity. And with this laser treatment, which is very safe and effective, we're able to knock that scar tissue out of the way so that it is no longer clouding up your artificial lens. The end result within about 24 to 48 hours is the vision returns to the way it was right after your original cataract surgery. Also of note, usually this scar tissue that has already been removed with the help of the YAG laser does not grow back in the future. So it is a one-time deal typically for most people to have this type of YAG laser treatment after a cataract surgery. Returning to our original question, can cataracts come back? The simple answer is no, they cannot. But as we've learned, a type of scar tissue called a PCO can make it seem like your cataract is back because it'll give you similar symptoms to your original cataract. But the treatment is pretty easy, efficient, and permanent, and involves a laser treatment in the office. If you are having trouble with blurry vision, glare, or halos, and you've already had cataract surgery in the past, perhaps you may need an evaluation for a PCO. Give us a call. We are experts in this field.